cœur de nos décisions, un des principes fondamentaux qui nous guident pour prendre les décisions qu'on vous présente aujourd'hui, c'est qu'on veut garder les élèves à l'école. On veut éviter le plus possible de basculer en enseignement à distance. On veut des écoles qui soient sécuritaires. On veut que nos enfants apprennent. On veut qu'il y ait des occasions de jouer, de voir leurs amis. Ça, c'est fondamental pour tout le monde autour de la table, au gouvernement, et je dis que c'est fondamental aussi pour les familles et le personnel scolaire. Mais comme on l'a annoncé le 11 août, pour permettre tout ça, bien, à partir de la première année du primaire, les jeunes devront porter le masque dans les aires communes et dans le transport scolaire. En fonction de l'évolution de la situation, avec la santé publique, en suivant leurs recommandations, on doit prendre la décision de rendre le port du masque obligatoire, même en classe, à partir de la première année, dans plusieurs régions du Québec. On parle de 9 régions. Centre du Québec, Estrie, Lanaudière, Laurentides, Laval, Mauricie, Montérégie, Montréal et Outaouais. C'est une mesure qui se veut préventive et prudente. On va voir comment la rentrée va se dérouler. On va voir comment les cas vont arriver ou n'arriveront pas. On le souhaite bien évidemment. Et il y aura ensuite, évidemment, des études épidémiologiques de la santé publique qui pourront nous guider. Est-ce que d'autres régions devront porter le masque en classe? Ou est-ce qu'il y a certaines régions où il y aura le masque en classe en début d'année, où on pourra donner des allègements et le retirer? C'est possible, c'est des choses qui vont être étudiées. Donc, dans les autres régions que je n'ai pas nommées, ils vont devoir porter le masque dans les aires communes, dans le transport scolaire, mais pas en classe. Je veux le nommer pour être bien clair. Donc, dans les régions qui ne devront pas porter le masque en classe pour les premiers jours de la rentrée, il y a l'Abitibi-Témiscamingue, le Bas-Saint-Laurent, Chaudière-Appalaches, Côte-Nord, Gaspésie-de-la-Madeleine, Nord du Québec, Lac-Saint-Jean et Capitale-Nationale. Le port du masque peut être porté aussi, évidemment, très souvent par le personnel scolaire pour le protéger à la fois le personnel et les élèves, mais dans ce cas-ci, on suit tout simplement les recommandations de la CNESST, comme on le faisait l'année passée. Ce qui veut dire en réalité, c'est que quand le personnel peut garder une distance de 2 mètres ou avoir une barrière physique comme un plexiglas, ils peuvent enlever le masque. Mais si on ne peut plus garder cette distance-là ou si on n'a plus la barrière physique, on doit remettre le masque. C'est sur une recommandation de la CNESST et c'est semblable à ce qu'on avait l'an passé. Pour nos jeunes, la formation professionnelle, formation générale aux adultes, eh bien, on se colle tout simplement aux mesures qu'on a en enseignement supérieur, donc au cégep. Donc, peu importe la région, formation professionnelle, formation générale aux adultes, il faudra porter le masque en tout temps, même à l'intérieur, même en classe. Ce n'est pas une situation idéale, ce n'est pas ce qu'on souhaitait au début de l'été, c'est sûr, mais il faut prendre acte de la situation, il faut prendre acte de ce qui s'est passé ailleurs dans le monde et de la montée du variant Delta. Je sais que cette annonce-là, le port du masque en classe, ça peut rassurer certains parents. Ils vont le voir comme une mesure de protection pour leurs enfants et leurs familles. Ça va inquiéter aussi certains parents parce que c'est pas normal hein, de forcer notre enfant à porter un masque en classe. J'en suis très conscient, moi-même comme enseignant et comme père. C'est pas normal de demander à notre enfant de porter un masque plusieurs heures par jour. Mais comme adulte, on a une responsabilité. On doit être bienveillant envers tous les membres de notre famille. Moi, j'ai la responsabilité, bien sûr, d'être bienveillant envers tous les élèves, tous les membres du personnel. On se doit tous d'être rassurants. Et j'appelle tout le monde à être évidemment réaliste, à écouter la science, à être rassurant. Il faut éviter de transférer à nos jeunes nos craintes et nos angoisses d'adultes légitimes. Mais eux, ce qu'ils veulent, nos enfants, c'est apprendre. Nos jeunes ont soif d'apprendre. Ils ont besoin d'aller à l'école. Toutes les mesures qu'on met en place qui leur permettent d'aller à l'école doivent être vues comme des mesures positives. Nos jeunes ont besoin de bouger. On leur permet de faire leur cours d'éducation physique. Nos jeunes ont besoin de socialiser, puis de voir leurs amis. Et ça nous tient à cœur de leur permettre de se développer et de faire toutes ces choses-là. Parlant de bienveillance, de mesures qu'on prend pour protéger nos jeunes, puis leur permettre de vivre une vie le plus normale possible, la mieux possible. On a eu des conversations avec la santé publique, Et dans des cas de chaleur accablante, les aussi qu'on en a eu dernièrement au Québec, le gros bon sens, comme disait M. Arruda tout à l'heure, Dr Arruda, doit s'appliquer. Donc, quand il y a une chaleur accablante, on peut permettre, même dans des situations où on devrait porter le masque, dans des régions plus chaudes, d'enlever le masque parce qu'il fait tout simplement trop chaud, c'est pas tenable. Mais c'est une situation exceptionnelle qu'on applique quand la situation météorologique est exceptionnelle aussi. Je veux insister sur un point important. On va agir sans relâche sur le front de la gestion des cas de COVID. C'est très, très important de continuer le travail méticuleux qui a été commencé l'an passé. Comme l'an passé, donc tous les cas qui seront déclarés dans les écoles vont faire l'objet de ce qu'on appelle une enquête épidémiologique par les directions de la santé publique régionale. La santé publique nous indique qu'ils vont moduler leur manière de faire ces enquêtes-là en fonction de nouveaux critères. Évidemment, la région concernée, le nombre de cas dans la région, le fait que les élèves portent ou pas le masque va influencer le travail de la santé publique sur la gestion des cas et la vaccination aussi des adolescents, qui est évidemment un élément positif, et ça sera pris en compte lors d'éclosion ou lorsqu'il y aura des cas positifs. Donc, moi, je suis confiant qu'avec ces mesures-là, on va pouvoir éviter dans plusieurs cas, pas tous les cas, mais dans plusieurs cas, des fermetures de classes, des fermetures d'écoles et des retraits d'élèves dans les écoles. On pourra donc atteindre notre objectif de garder le plus possible nos écoles ouvertes, nos élèves à l'école, nos enfants à l'école. Je laisserai tout à l'heure, évidemment, Dr Arruda préciser les modalités de ces protocoles d'intervention quand il y a des cas positifs. Quand malheureusement surviendront des cas, et que des jeunes devront être retirés, je veux juste rassurer les gens, évidemment, on va donner aux jeunes des services éducatifs, on va leur donner du soutien, de l'appui, comme on le faisait l'an passé. On avait déjà développé l'an passé, avec les gens du réseau scolaire, des mécanismes, des seuils minimaux, des barèmes nationaux pour être sûr d'avoir une équité, puis qu'il n'y ait jamais de jeunes qui sont sans service, sans soutien pédagogique. Un élément que je veux vous partager aujourd'hui, qui est une nouveauté, je veux vous dire qu'on travaille main dans la main avec la santé pour implanter l'utilisation de tests rapides qui seront déployés dans certaines écoles dès le mois de septembre, graduellement. C'est un outil de plus dans notre coffre à outils pour garder nos écoles ouvertes et nos élèves à l'école. Et ça, c'est quelque chose qu'on a réussi très bien l'an passé, même dans un contexte de grave pandémie. Il faut quand même se dire qu'on était au Québec, un des endroits dans le monde où les élèves ont le plus fréquenté l'école. On peut être fier de ça comme nation, d'avoir réussi à garder nos élèves à l'école, plus que les autres. Mais Joshiku disait, on doit être reconnaissant envers le personnel scolaire, parce que ça, c'est une réussite qu'on doit vraiment au personnel de soutien, aux gens du service de garde, aux professionnels, aux enseignants, aux directions d'école, à tout le monde. C'est eux qui ont porté le réseau à bout de bras l'an passé, et je sais qu'ils vont être encore au rendez-vous cette année. Un mot sur la vaccination. Les dernières données nous indiquent que ça va très bien. Il y a plus de 85,2% de nos jeunes de 12 à 17 ans qui ont reçu au moins une dose. Et quand on regarde pour la deuxième dose, ceux qui ont une deuxième dose ou alors un rendez-vous pris pour avoir incessamment la deuxième dose, on est à 76,7%, presque 77% des jeunes qui ont soit une deuxième dose, soit un rendez-vous pour recevoir la deuxième dose. Donc la campagne va bien, mais on en veut encore plus. On veut qu'il y ait encore plus de jeunes qui soient vaccinés. On sait que c'est le meilleur facteur de protection. C'est un élément extrêmement important pour protéger les jeunes, le personnel et leurs familles. Donc, on va travailler dès les premières semaines de la rentrée avec la santé pour reproduire ce qu'on a fait au début du mois de juin, c'est-à-dire des campagnes de vaccination en milieu scolaire ou avec l'aide du milieu scolaire, si on peut utiliser le transport scolaire pour se rendre dans des centres de vaccination, informer les parents, puis donc améliorer notre couverture vaccinale. On travaille là-dessus, c'est sûr. Je veux mentionner que les mesures sanitaires qu'on met sont préventives. On les souhaite temporaires, mais évidemment, on va devoir s'adapter. Est-ce qu'elles dureront ou ne dureront pas? C'est l'épidémiologie, évidemment, la santé publique qui nous diront. Mais elles sont préventives pour favoriser les apprentissages des élèves, le bien-être du personnel et la sécurité de tout le monde. Avec toutes ces mesures-là, avec la planification qui a été commencée depuis le mois de juin dans le réseau scolaire. Puis je veux remercier les partenaires pour leur excellente collaboration. On va être prêt pour une rentrée qui est prudente. On est prêt pour mettre tout en œuvre pour permettre à nos jeunes d'apprendre en classe, en personne, avec leurs amis, pour leur permettre de socialiser dans un contexte qui sera sécuritaire. Je veux remercier la santé publique, remercier ma collègue et tous les partenaires du réseau qui partagent ce même objectif, garder nos écoles ouvertes. Merci.
Merci. On passe maintenant la parole à Mme Isabelle Charret.
Oui, merci. Merci Jean-François, chers collègues. Merci Dr. Arruda d'être ici. Je pense que ça a été bien nommé, bien mentionné par Jean-François, la notion de prudence et à quel point on l'a été et à quel point on continue de l'être. Mais malgré ça, je suis très heureuse de pouvoir vous dire que les jeunes vont, comme on l'avait mentionné, pouvoir reprendre leurs activités parascolaires dès la rentrée. Et parce que cette année, on n'a pas le concept de bulle classe, dans les écoles, on va pouvoir reprendre l'ensemble des activités. Donc les jeunes vont pouvoir répondre à leurs intérêts, à leurs aptitudes avec ces activités qui, on le sait, leur tient tant à cœur. Des mesures, évidemment, seront établies pour bien protéger les jeunes parce qu'on veut le faire de façon sécuritaire. De sorte que pour les élèves du primaire, les activités parascolaires et les activités sportives vont se dérouler de façon normale. Par contre, au secondaire, le passeport vaccinal sera requis dans l'ensemble des régions du Québec pour pratiquer les activités sportives, les sports à l'intérieur et pour les sports d'équipe ou activités physiques à l'extérieur, les activités évidemment qui impliquent des contacts fréquents ou prolongés. Donc on pense à des activités à l'extérieur comme les sports d'équipe, le hockey, le soccer, le football. Toutefois, les élèves n'auront pas besoin d'un passeport vaccinal pour pratiquer les sports, les activités physiques qui font partie de l'offre des programmes d'éducation physique et des différentes concentrations, sport-études, projets pédagogiques particuliers, qui sont dispensés dans le cadre des services éducatifs. Cependant, dans les cas, par exemple, des programmes particuliers de sport-études, le passeport vaccinal sera requis pour participer à certaines activités interscolaires comme des matchs ou des compétitions. Toutefois, et Jean-François en a glissé un mot, puis Dr. Arruda pourra préciser, mais dans les cas où il y aura des régions où il y aurait des éclosions, il y aura des modalités, là, il y aura peut-être lieu de retirer les élèves de certaines activités parascolaires. Alors, Dr. Arruda pourra plus le préciser tantôt. On a fait le choix d'être prudent et évidemment, c'est pour ça qu'on applique le passeport vaccinal dans les activités physiques, les activités sportives à l'école. Mais parce qu'elles sont si importantes pour les jeunes, je pense que c'est...
In sports activities in the school, but because they're so important for young people, I think that it's really a measure that will ensure that they will be able to do these activities. So, of course, we will continue to be prudent, to act in a safe manner, but I think that it's still very good news that we're announcing today to say that these activities will occur. And once again, the takeaway message is that for young people 12 and up, the best way to protect yourself and to lead a normal life is through vaccination, because that is what will allow us to practice our activities more freely and to do it in the school and also in all contexts. So I know that young people were resilient. I know that they were able to adapt. We still have some efforts to deploy, and I'm certain that students will be there. So I wish everybody a really good back-to-school season, and thank you. Thank you. Now we will go on to the question period for the reporters who are here. I will begin with Philippe Bonneville.
Bonjour, Philippe Bonneville, 98.5. Monsieur Roberge.
Mr. Roberge, you said several times that the safety of students or health is the priority. You say the best way to protect students and staff is vaccination, is a priority. We really want to avoid the transmission of the virus and school closures, etc. But then, why, up until now, do you refuse, you and your government, to make vaccination of teachers mandatory if it can protect people. And right now, what is the percentage of teachers in Quebec who are vaccinated or double vaccinated? Thank you for that question, because it's a question that I've been asking that many people are asking themselves right now. And I must tell you that the government, following the recommendation of public health, was quite clear when it came to mandatory vaccination in the health network. But on the how and the conditions and the impacts and all of this, is going to be a parliamentary commission. And I know that during the parliamentary commission, there are some people who will talk about mandatory vaccination more broadly. And they will talk about the possibility of doing so for the education network. So we will wait and see what the groups will say. But now, as to the rate of vaccination for the school staff, we're gathering information right now. So you have no idea for the time being? Because people have been getting vaccinated for 8 months. You have no idea of the percentage of people vaccinated who work in schools. In your opinion, as a minister, do you believe that mandatory vaccination, well, yes, there's going to be a commission and all of that, and they'll talk about it. But you, as a minister, as a person responsible for the health and safety of students, do you believe that it's a measure that should be imposed to ensure the safety and health of students? We all want the vaccine coverage to be at its maximum throughout Quebec. Right now, I'm confident that there's many people in the school system who have taken advantage of the abundance of vaccines and the quality of the organization of the health network in order to get vaccinated. You know, the QR code, everything was remarkably well done by public health. Now, for mandatory vaccination, I think that there's a debate that will be held. There's a parliamentary commission. We'll hear what people have to say. Question? In the initial back-to-school plan, there was no distancing for students. However, last week, the ENSPQ said that there should be distancing, assigned places in the classroom. They even talked about mask wearing, which you're confirming today. How come in 1 week, it took a week for the minister of the decision had to be made on the mask wearing? The plan in mid-August and the mask wearing measure was a second layer of protection. When we looked at the analysis done by the Institut de Santé Publique, the easiest measure to put in place that also allows to avoid classroom closures is mask wearing. We needed to be as close as possible to back to school to see what would be the regions for which we would require the mask wearing. You'll understand that over the past 3 weeks, really the past 3 weeks, we saw a much more significant increase in cases than at the same time last year. Luckily, thanks to vaccination, which is a success in Quebec, I want to tell you, our objectives were surpassed. We're among the people who have really a gold medal when it comes to vaccination. Despite all of this, or thanks to this, we don't have as many hospitalizations and people dying. We have more cases than previously, but what we believe will happen with back to school is an increase in contacts. Young people are not vaccinated, so there will be more transmission. And the best way, the simplest way to allow a normal back to school is mask wearing. That's the decision that was made by public health following the recommendations that were made. We wanted to maintain, as the Minister of Education said, we wanted to have a back to school that was as normal as possible, because the class bubbles has certain effects, yes, but it also has negative effects on the education of children, their development and their socialization. You know, in health, there's the infectious disease, but there's also all the other consequences on child development. And currently, this is a temporary measure. Some may be disappointed, but it's going to help us so much to avoid classroom closures. Because when you wear the mask, even if you were in close contact, without distancing, you are considered as being a low contact. So then the intervention protocols are not as severe. Now we're talking about masks in a classroom, so there'll have to be masks for students in every one of the 9 regions. They're going to be changed every day. So does the ministry have stocks of masks, or will you be supplying masks to all the families and students? Yes, this is something that we had anticipated so that we could be ready for any situation. I told you that in June we had given the broad strokes. There was to prepare the school system for back to school. And in the broad strokes that we had given in June was to get ready in case and to have in all schools of Quebec a 1-month inventory of masks to be ready if ever a variant surprised us. And this is what happened. And we are very pleased that we were ready. So there are no worries. We have enough masks, quality masks, which are procedural masks, and they offer good protection, and we have enough to provide them to all the schools. Question for Minister Roberge. You talked about the implementation of rapid tests when a case is suspected in a classroom in some schools as of September. So I'd like you to specify or to explain exactly what does it mean when you say certain schools. It's not all the schools in Quebec, from what I understand. And what will happen in the case of an outbreak in a classroom or in a school? Well, these are medical decisions. This is something that we are happy to add to our toolbox. But for the protocol of use, I will hand it over to Dr. Arruda. Well, I would like to tell you that we still had the tests that we had before, which are very high-quality tests. We are evaluating the increase in the capacity because we'd like to do the saliva tests. And depending on the incidence of the illness in certain territories and regions, particularly in schools, where there's a low vaccine coverage and where there's a greater risk of outbreak, well, the use of rapid tests will be useful and will be added to our toolbox. But for the regions, for example, that will not have rapid tests tomorrow, they will have access to a result that's just as quick through other types of tests that are just as effective. But in certain contexts, I would tell you, particularly in urban contexts where we believe that the vaccine coverage is lower, they were used in certain pilot projects, and this will be part of the toolbox, and it will be implemented progressively so that we make sure that it's working well. So the PCR test that you're talking about will be used in the school or in screening clinics like was done last year. There will be some tests done in the screening clinics, but there could be some tests that will be done in the school, either by the public health teams in collaboration with the school environment. We'll work with them. But it's not the great majority of the schools. It's just a certain number of schools where the vaccine coverage is lower, right? Well, we're starting like that, and we want to validate the feasibility because these tests require additional resources. And I have to tell you that actually we will rely on the organization of services, of labs that can vary from one territory to the next, depending on their staff and their capacity. Now, for the parents who are listening, they must be wondering, tests are done by, is it through the nose or saliva? And will some students have to get the nasal tests and the parents will not know? Well, we never do tests on children without getting the consent of parents. And what we're aiming for as much as possible is to have what we call, the saliva test, which is not as invasive, especially to repeat the test on day 3 and day 7. What's extraordinary right now versus what we used to do previously is that the students will be able, because they're wearing a mask, they'll be able to go back to school. They won't be removed from the classroom. All the contacts will not be removed from the classroom to go to online learning, but they will stay in the classroom, and with the test, we'll be able to know and to identify quickly to see if there were some secondary cases. And when you talk about the Montreal region, the rates are not the same. For example, in Beaconsfield, I don't know if you include that in the Montreal region, and let's say in Park Extension. Exactly. So in Montreal, how far does it go? The mask wearing. The mask wearing, it's by region, right? We don't subdivide the regions in subsectors. So the regions that have a high rate of transmission currently and that could increase significantly, they will wear the mask. So Montreal, Laval, all of Laval, the Laurentians, Lanaudière, Montérégie, Outaouais, these are regions where mask wearing will be mandatory. So Montreal and the boroughs. Well, the island of Montreal, the island of Laval, the Montérégie, Lanaudière, Laurentide. Perhaps I'm forgetting some regions. I don't have the list in front of me, but there's also Mauricie, Centre du Québec, you know. There are other regions. The vaccination campaigns in schools, is that ongoing? Or that will, yes, thanks to the collaboration of the school systems at different levels. We're planning all of this right now. All the CSs have a plan to continue to offer the vaccine in the schools, either in the school setting or through transportation systems where they can go to vaccination clinics.
On va maintenant passer aux questions en ligne. Alors, Claudie Côté.
Question.
Bonjour, est-ce que vous m'entendez bien?
Oui.
D'abord, j'aimerais peut-être une question pour
A question for Mr. Arruda, and Mrs. Charret, you can add as well. Mr. Arruda, I'd like to know what's happening with vaccination for young people who are 11 and who will be 12 soon. Right now, they don't have access to vaccines. Have you rendered an opinion on this? And for extracurricular activities, young people who are not vaccinated because they don't have access to the vaccine, will they be able to do the extracurricular activities? How will this happen exactly? For 11-year-olds, you'll understand that the question was asked to our immunization committee in Quebec. For the time being, we don't want to use the vaccine in a way for which it wasn't approved. And we know that recently, or soon, not tomorrow, but soon, it will be approved for the 5 to 11-year-olds. So we will wait for that to be done. And now, for young people who can't be vaccinated, they'll be able to do their activities, their extracurricular activities. It's not their fault if they weren't vaccinated. That is what was decided. It's those who don't have access to the vaccine, not those who decided not to be vaccinated. But the students in elementary school, the extracurricular activities will occur, whether it's sports, indoors, or contact sports. So for elementary students, it's normal activities. For high school students, the vaccine passport is required for indoor activities and for some outdoor activities where there are frequent contacts. Question? I'd like to have more details on what's going to happen if there's an outbreak in a classroom or if there's a positive case. The unions, the teachers are asking for a clear plan. So what will happen if there's a case? Do we use a rapid test? Do we isolate the child? Is the classroom closed? I'd like to know what are the steps to follow when there's an outbreak or a positive case. Essentially, I would like to tell you that the protocol to manage cases and contacts, it will be published soon. It's aiming for one thing. It's to keep children in school. With the mask wearing, what's good when it comes to managing cases and contacts is that if people wear the mask at all times, the advantage is that we consider exposures, even if they were for more than 15 minutes, but those are low exposure situations. So the only person who will be removed from the environment is the positive case because they are sick and they have to go home. And they have to keep an eye on their symptoms and be isolated while they're contagious. The others will be able to go back to the classroom by wearing the mask because they're already wearing it. And then we will test them on day 3 and day 7. And if they don't have, and if they're not ill, they will not be removed from the classroom. Whereas before, we used to remove all the contacts from the classroom, and that will not be the case in zones where there is no mask currently. What is being done is that if we've changed things to allow students to go to the classroom, but with a mask, they will not go to their extracurricular activities, but they will be able to continue their learning while wearing a mask. And then we'll be able to do tests on day 3 to 5 and on day 7, which means that managing cases and contacts, will be simplified through mask wearing. That will help us keep students in the classroom. It doesn't mean that if there's an outbreak with a lot of transmission in a classroom, for example, we realize that after the tests, there's 4 or 5, 6 people who are sick, that the classroom will not be closed. But it won't be the same type of situation that we experienced previously. If you'll allow me, I want to mention something. I really want to thank the public health team. They have this concern of adapting the protocol to the situation that we've got today. We're adding protective measures. We have the vaccination campaign. And this changes our actions so that we can keep kids in school as much as possible. Yes, unfortunately, there will be some positive cases. Some students will be removed from the classroom. Maybe some classrooms will be closed temporarily, but I really see this willingness from public health to do all that they can to limit exclusions of groups and closures of classrooms. This is something that will make a difference in learning and in the mental health of young people, and I think that it's extremely important. Thank you. Question? I would like to ask what's going to happen if there are isolated students because they have a positive case or if there are classroom closures. When it comes to teaching, can we expect or not to virtual teaching when there will be a few children isolated or a classroom that is closed? Last year, we had already deployed all the mechanisms to be able to go quite quickly to online learning when we had to close a classroom. And we had also deployed, during the school year, some directives and national directives to make sure that if it's 1 or 2 or 3 students from a classroom who are removed from the classroom, whereas the rest of the students stay in the classroom, that there be services for these students. So the directives from last year still apply this year. The school system has already received these directives. So there will have to be, after 24 to 48 hours, if a child is excluded from the classroom, on a daily basis, there will be a follow-up made, a phone call, documents will be sent, work will be sent to make sure that they don't fall behind. So if I understand correctly, if there's 1 or a few students who are isolated in the classroom, there's not going to be virtual teaching, but there will be daily contact with the teacher. Yes, it's possible that some teachers who have the technical skills, who have the desire to do so and the equipment to do so will teach remotely. But it's not something that we can force and that we can impose. We don't all have the skills to do this and the technological equipment. What is certain, though, is that all students will get daily contact and some work, and we will bring them back to the classroom faster than previously. We will have a lot more students in the classroom, and so that question will not be as great an issue as last year. We will now go to the English questions.
Hi, Valeria Corey Minocchio, CBC. My first question is for Minister Roberge, just regarding the mandatory masks in classrooms in the 9 regions in the province. Could you just explain, just in English, why you're making this change at this point? Days before some schools start classes.
Well, of course, we are following the recommendation of public health authorities. Our ultimate goal is to keep students in school and avoid closing classroom, and as much as possible, avoid distance learning. So, taking note of the evaluation of the sanitary situation, we've decided, in accordance with the recommendation of the public health, to make the wearing of the intervention mask mandatory at all times, indoors, starting from the 1st grade, but for 9 regions only, because of the rise of the COVID and the Delta variant on those specific regions.
And my next question is about how will this rapid testing, how will it work? How will it sort of roll out?
In fact, you should understand that we will keep also the other tests we had before, which are very good tests, which are PCR. We're going to also try to emphasize and have more gargarism, which is with saliva, not really having with the nose for that. And on specific schools where probably in regions where the transmission is higher and where there is a lower coverage and a higher risk of vaccine coverage and a higher risk of, I would say, outbreaks in schools, those are going to be used in those specific situations to help to keep people rapidly back to school, or at least making sure that if they are sick, they can get out from school. So, it's going to be related to the epidemiology, because those rapid tests, antigenic ones, are good in certain situations and not good on others. So it's going to be taken into account.
So just to clarify, because it was said before in French, where you're starting out in some schools, is there like a plan to roll it out like by a certain date across all the province?
In fact, we are going step by step. I would tell you that perhaps it's going to be used everywhere, but it will depend on the evaluation in reality, because those tests need a lot of resources, human resources, but they can be, we want to make sure that there is a plus value on those use and in which kind of situation comparing to the other approach.
Thank you.
Grillo from CTV News. I'm just wondering, there seems to be quite a big change in the contact tracing this school year compared to just a few months ago in last school year. Why is that exactly?
Well, it's related to the fact that we are managing the risk. I think the Delta situation and the rising we see 3 weeks ago make us use the mask, which was something that was already planned, even in, I would say, in June and in August. But I would say that we understand the impact. First of all, in high schools, there is eye coverage. I can say that it's a real success, the vaccination. It's clear that in the younger ones, there is no vaccination, but the risk of them getting the disease and having big problems is low, but they can transmit to others. So we are managing, I would say, the need for kids to stay at school. You know, the impacts of having not a normal school life could be for years, especially when you're young. So it's why we are balancing that, and we think that we could manage that situation. And probably, I cannot say when exactly, but probably during this school year, there's going to be vaccination for the younger ones too, when the vaccine is going to be authorized by Health Canada.
So for 12, I guess 11 and under is what you're saying.
Exactly, from 5 to 11.
And I'm just wondering, there are some people in the education community who feel as though all these details are sort of coming out at the last minute. Perhaps maybe the minister can chime in here. What are your thoughts on that? Do you feel as though this is a little last minute, given that classes are next week?
Well, as I said, we gave a lot of directions in June. We already said that we won't have some bubbles, you know. Students won't have to stay only in their classes, though we said that in June. We gave all the direction for transportation, how many kids they will kind of have by bus. We tell those things in June. We tell about extracurricular activities in June. But for the mask and for sanitary directive, we had to wait. We have to be sure to be to have all the information to make the decision. And for that, we did it from the expert. We have to follow the public health authorities because they are the expert, and we are really grateful that they help us keep our school safe.
Phil Autier.
Good afternoon. I'm just wondering a quick technical question, Mr. Roberge. Why are masks not being required in schools in Quebec City?
I think it's a decision
it's related to the epidemiology. You know, when you look at the cases of the last weeks, they are higher in those regions, and it's going up from an incidence. Quebec is just, I would say, in a place where the incidence is not going up. There is no much hospitalization and in that. I'm not telling you that in Quebec or in other places that things could not change, but actually there is not enough virus in the region to exile. And if it was the same thing here in Quebec or in Montreal, we should have done the same thing. It's why we had to wait to see what was going on. 3 weeks ago, we were not in this situation. Now we are having week from week to week more than 30% more cases than the weeks before. Fortunately, because of vaccination rates, there is no much hospitalization comparing to the second and third wave, which is great. So it's why vaccination is the solution. It's why we are very proud of obtain our goals actually, but using the mask because of this period where there's going to be the rentrée scolaire with a lot of contacts, we think there could be an acceleration, and it's why we are putting the masks to lower the risk of outbreaks in schools. That will go to community.
And my second question for Minister Roberge, can you update us on work being done to improve ventilation in the schools? How is that coming along now that school's coming back and the students will be with masks? But how is your progress coming on ventilation improvements?
Well, as I said earlier in August, we made a lot of work, a lot of renovation during summer in our schools. We did improve a lot of ventilation system. A lot of windows have been changed or renovate to be sure that they can be open easily. And we will put on a report saying everything we've done during this summer in a few weeks. Because as we speak, people are still working.
Are you disappointed that we have to go back to masks? In June, you were very optimistic. You thought the worst was over. And now we seem to be going down that path. Are you disappointed yourself?
Of course, I would prefer that we get rid of the COVID, of course. But what I'm glad is that we are well prepared. We have some good advices, and we are able to keep our schools open, and that's the most important.
I just can say that I would be very happy if Delta virus doesn't exist.
Yes, of course.
That's the problem.
We're going to still go with Raquel Fletcher, and then je vais retourner en français parce que j'ai eu un problème avec mon ordinateur qui a manqué de batterie. Donc, on va faire Raquel Fletcher, et ensuite de ça, on pourra revenir en français.
Good afternoon, Minister, Dr. Ruda. My first question is about outbreaks in classrooms. You're changing the process. You explained how that will work in French, and you explained that it will be different in classrooms where everyone is wearing the mask versus the classrooms where the mask isn't necessary. Can you just explain how that's going to work now in English for our viewers, for our English viewers?
Yes, no problem. In fact, we had adapted our protocols to have a risk management that will keep most of kids in school and not have to take off everybody in contact with cases. The use of a mask between the case and, I would say, the contacts in class almost all time will make their contact, their risk low. We call it a low risk. So in that situation, the case will have to go back home and have access to teachers every day. But the other ones could stay in class, and they are going to be tested on day 3 to 5 and on day 7. And if they are not having the disease, they will stay so there. In the case where there is no mask, I would say, procedure use, what's going to happen is that the case will go back home. The other kids will be able to stay, I would say, in school using masks because they were not using it before, but they will use masks. They are going to be tested. And because they were more exposed, the risk is higher probably than if they were wearing masks before. They will not be able to attend in the next 14 days or 10 days their activities parascolaires, what is not academic, just for lowering the risk of having an outbreak. So this kind of management with masks going back to school and adding tests is going to keep mostly kids in school. If there is big outbreaks, if there is in a class 5, 6 cases, that's going to be a little bit different, but it will not be as systematic as it was before in the wave 2 and 3.
Thank you for that. My second question is for Minister Roberge. We're hearing from parents whose children are immunocompromised or have other serious illnesses, and they've been told that they will have access to online learning this fall, but they haven't received any details or any of the like how that will be rolled out, how they will access that, how that will work, what that will look like. I'm wondering if you can tell us today, for those students who do have severe illnesses, what will online learning look like for them?
Well, with medical advice, they will have access to distance learning just like last year. So nothing changed. If they have a medical advice, maybe a sickness related to COVID or something, of course, valued by a doctor, they will have access to online or distance learning just like last year.
Merci. On va revenir en français avec Chouan Femme ici au micro 2. Merci.
Question. Today, there are 2 establishments that have sounded the alarm on the lack of staff. Another who is relying on the return of exempted staff to fill this gap. Can you tell us, how is it that within a year the situation has not improved or even got worse, according to these establishments? Well, we don't have the numbers to see if the situation has improved or gotten worse versus last year. There's some preliminary information, but we are gathering this information. We'll have it in the next few days. One thing's for sure, the lack of labor hits education as it hits the healthcare network, as it hits many sectors right now in Quebec. I would tell you that in education, it's extremely serious, and it has been for several years. And we have to put this back into a context with the previous governments, where for many years neglected the school system. We didn't invest enough to renovate our schools or to build schools. There were some years under other governments where they laid off specialists and speech therapists, and it sent the wrong signal. Over the past few years, since the arrival of the new government, there's been an increase in registrations in faculties or excellence bursaries for students who choose to go into education. There are new programs that were put in place so that people who have a bachelor's degree, let's say in literature, in French, in science, in geography, or history, can become teachers quickly and complete their training through alternative training with what we call qualifying programs. And this works, but it's going to take some time to get through this crisis. We are conscious of this, we're working on it, and we're doing so with all of the partners in the school system. My question is for Minister Roberge. We know that young people 12 and under aren't yet vaccinated against COVID-19, but those 12 and up are vaccinated or can be vaccinated. So they've asked us, why wouldn't it just be students in primary schools who would have to wear the mask in the classroom? This is a public health issue, but I must say that that difference from one region to the next, depending on the epidemiology, or between elementary and high school, according to the vaccination rate, will be taken into account by public health when there are cases, when we have to manage outbreaks and the removal of students. And we hope that there will be as few as possible. Now, when it comes to the mask wearing, it's a precautionary measure that is being implemented following a recommendation by public health. Perhaps Dr. Arruda can speak to this. Well, we have to understand that vaccination is very important because young people from 12 to 17 who are vaccinated will not have severe complications or be hospitalized or die, except for some very rare cases. So that's very important. And thanks to this, right now, we have more cases and fewer hospitalizations and deaths. But what we know, however, is that even if people were vaccinated and they don't get ill, they can still transmit it. They could be asymptomatic and they can transmit the illness. That is a characteristic of the Delta variant. And so there could be some transmission, and these people could contaminate other people. That is why, as a preventive measure, to avoid a significant increase in the number of cases when kids go back to school temporarily, we'll see how long it lasts. I can't give any guarantees, but mask wearing will decrease this transmission in school settings. And we know the percentage of young people who are fully vaccinated in high schools? Well, it's high. From my understanding, if I remember well, it's above 82%. I'm not sure. Do you have the exact data? Yes, when we say in our high schools, so it's young people from 12 to 17. So for 12 to 17-year-olds, we've got 85.2% of young people who have received at least one dose. 76.7% of them have received 2 doses or who have their first dose and an appointment for the second dose. So it's working well, but I think there's still some work to be done to make sure that the second doses are given to those who have an appointment. And there's still 15% of students, or close to it, who haven't received any dose. And I think that we must continue our efforts to explain the advantages of the vaccine. Question? Quickly. The division of the regions, you mentioned it quickly, the subdivision of regions. Will that be done over the next few weeks? The subdivision of regions? Yes, for example, let's say in Portneuf, no mask, downtown Quebec, masks. Well, it's not something that we're studying right now. There are negative effects to this type of approach, and you know, the illness travels from one region to the next quite quickly. So I would say that this is not what we're working on right now. Are we to understand that the criteria that have been chosen to say, yes, mask in the classroom in Montreal but not in Quebec are the same as they were, for example, the color zones? So that is, it's based on incidence of cases. So, of course, and here we're not talking about color levels. The incidence that made us go from green to yellow is an incidence that sends a signal that, you know, it has to last for a few days, and also a trend, an increasing trend. And we also look at vaccine coverage, but more and more for populational measures that we will implement either in school settings or elsewhere, we will take into account the hospital capacity. The hospitalization indicator will be the most important indicator. So deaths and hospitalizations, because we can have a lot of cases but not many hospitalizations. And what we want to avoid with the fourth wave is a healthcare system that can no longer meet the demand for COVID-19, but also all the other surgeries and operations that are necessary for the well-being of the population. So from what I understand, it's that you don't have a rate of COVID by region that has made you make the mask mandatory in one region versus another. So you don't have a magical number. Well, we look at incidence, which corresponds to the previous yellow or green levels that we had previously. It has to be maintained for several days above that, and there has to be an upswing in the trends. So it's a bit of a mathematical calculation, but we can say, well, this one here, they're at the stage of significant transmission, so we will require the mask. So it's yellow. Like to give people an idea. Well, let's say yes. For those who want to refer to the previous system, yes, it's yellow. But I want to tell you as well that we're not just looking at these levels because we will come back to, because we were working differently than how we worked previously. Thank you.